Doctors of Reddit, what is the weirdest thing a patient wouldn't admit? Please like, subscribe and comment so I can create more videos for you. Not a doctor but a nurse. Had a patient come in with a toothpick in his penis. Refused to tell me how it got in there, insisting he was picking his teeth and it fell in. Just curious, why should the patient explain how it got in as long as we know what is inside and where? Being pregnant and also a virgin. People actually believe women can get inseminated in a public pool or after their parents had sex in the jacuzzi and the girl uses the jacuzzi and is inseminated by the father. I work L&D and we had a Virgin Mary this weekend. It was an intrauteral insemination, not a stupid lie, for the first time ever. I admitted a guy for chest pain. As part of the workup, I did a urine drug screen which came back positive for cocaine. After the rest of his cardiac workup was negative, I said to him, "Good news, you didn't have a heart attack. It's likely that your chest pain was caused by cocaine." His answer, "I didn't use cocaine. See, I was at a party and people had some lines of cocaine out on a table. As I was walking by, an oscillating fan blew the cocaine into my face, which is why my urine was positive. MMMHMM. Got it? Yeah, cos parties with cocaine on the table frequently have fans near the coke. Obligatory. Not a doctor, I'm a nurse. We had a patient come into the operating room for brain surgery. Probably a mid-50s guy with a nice head of light brown hair. Before a patient comes into the actual OR, we ask them a series of questions, including whether they have any implants, jewelry, non-hospital clothes on, etc. Guy says no to all the questions. After the patient gets put to sleep, the surgeon grabbed his hair to start shaving it off, because brain surgery, and all his hair peeled off because he was wearing a wig and didn't tell us. We almost shaved his hairpiece because he wouldn't admit to anyone he wore it. There was a dignified British actor called Anthony Ainley who played the Doctor Who arch-enemy the Master in the 1980s. He wore a hairpiece in real life, but refused to ever admit it and took great pains to hide it. There was a Who story in which the Master was in disguise as another alien character who was bald, and, as Ainley passed away long ago, people who worked on the show now freely tell the behind-the-scenes story of how he insisted, "Well then, we'll have to do a bald cap, won't we?" No matter how much the makeup department tried to gently hint that there might be a simpler option. So, the makeup folks dutifully sat this gentleman in his makeup chair and proceeded to stretch a rubber bald cap over his toupee. Of course they couldn't quite make it work. That's an insane thing to try to do. In deference to the actor's vanity, they took him from the communal makeup area back to his own dressing room, did his alien makeup, TARDIS fandom webpage, onto his actually bald head, then brought him back out and pretended they had just done a very successful bald cap and everyone else just went along with it. I say this as a comfortably bald guy myself. Some people can get very freaking weird about hiding their baldness. Nurse here. Had parents bring their 3-year-old son to the emergency department for 1 month of abdominal pain that kept getting worse. I ask all the routine questions for this complaint. Lots of questions about his poop. Is it bloody? Diarrhea? Mucus? When was his last bowel movement? Any changes in the stool? They deny any other concerning symptoms but abdominal pain. We do blood work, ultrasound, X-ray. Everything comes back completely normal but the kid is intermittently screaming in pain, curled in a ball. Over the next 5 hours I continue to repeat the same questions. I asked repeatedly if there was anything else going on that they could think of. Nope. The kid just doesn't seem well but we have no reason to keep him. We decide to watch him a little longer. Let him eat. The kid eats a bunch, a PBJ, apple juice, crackers, popsicle, no pain, so we decide to send them home. I bring in the discharge paperwork and I'm about to start going over instructions and their dad goes, for the past 3 months he's had a lot of worms in his poop. Worms. Fucking worms. You spent 6+ hours denying worms. I literally just turned around and walked out of the room without saying a word. I was laughing almost to the point of tears. Could not wait to tell my resident. Deworming, medications, A shitload of wasted time, and they were on their way. Jesus Christ. Isn't having worms for like 3 months dangerous for the kid? Or are they not that harmful? One of my lecturers told us a story of when he worked in ED. There was a man who refused to acknowledge or tell them how a jar got stuck in his rectum. They were taking him to the OR as it has created a vacuum seal and couldn't be removed without shattering, but realized his BSL, blood sugar level, was off the charts. Really high. They were considering postponing the surgery to work out WTF was going on. When he ended up talking, he told them the jar was full of honey before it got lodged, and was rapidly absorbed by the rectum, causing the insane levels. What? Had Pooh Bear's honey addiction gone too far, and he found that the ass was a more effective way to get the honey into his system? I'm a pediatric dentist, so maybe not the type of doctor you were looking for, but this one throws me for a loop every time, so I'll share it. When I sedate kids, they have to be NPO for 8 hours before, so I always ask if they had anything to eat or drink in the morning. Parents never want to admit their kid ate or drank, even when I remind them it's very important, because if they vomit and aspirate they could die. Often they try to minimize it and say it was just a few bites, but one kid walked in eating a bag of Cheetos at reception, and then the parent insisted to me that they hadn't eaten. Yeah, I'm 100% not sedating your child today. I was operating away when suddenly the anesthetist is telling me to stop. The child isn't right. Then muck started coming out around the tube. The kid had ate. The parents had lied. From memory, the kid was in pediatric intensive care for 2 days, but left the hospital without any long-term issues. I was pretty furious. The anesthetist, though, red hot angry. The process in Australia is that the parents are asked 4 times before the kid goes off to sleep when they last ate. Check-in nurse, anesthetist, pre-op bay, theater room. And I asked once myself, so that's 5 times the parents lied. Obligatory, not a doctor. Used to work PR and marketing in an inner city hospital. Was once hanging out with the folks when a regular came in. He was into self-harm. This would have been in 2001 or so, and I was young, so I had never even heard of this. This guy had spent hours burying a Phillips head screwdriver in his abdomen, carefully working it around major organs. He was a Vietnam medic and had some training, so he could feasibly do it. He straight up said, "What screwdriver? You all are crazy." The attending was staring right at the X-ray and the handle of the screwdriver sticking out of his abdomen. The screwdriver must have been 4 inches long. I still shudder. I once had a patient come in with large calluses on the front of his ankles, which is a very unusual place to get calluses. I brought it up a few times because I thought maybe he was wearing his shoe wear improperly, but he kept waving off the question. Eventually I got him to admit that the calluses are there because he recently started taking a prescription antidepressant medication, which made it very difficult for him to achieve orgasm. He found that if he lay on his living room carpet with his legs bent out beneath him in a W fashion and jerked off for several hours, he was able to achieve orgasm. Nurse here had a patient accuse me of shitting in her bed and threatened to sue me for malpractice. Keynote: she never got out of her bed. Haha, yes, I've had this one too. An old chap swore up and down with great indignance that he didn't shit in his bed. It must have been somebody else. I just responded with, "Oh dear, well let's just get this cleaned up," while trying not to die laughing. Had a patient in hospital, I forget what for. The point is that he disappeared for a few hours. When he came back he was tachycardic to 160 BPM, massive pupils, couldn't sit still. We asked him what he'd taken while he was out. Nothing, he swears. He went to the pub and just drank lemonade. Okay, we say, "We're gonna take some blood and find out what you've taken." He then pipes up they the friends he was with would think it was funny to spike his drink. What? We asked. Did he think they might have spiked his drink with speed? He says. What do you know? Bloods confirmed that he had taken speed. But he insists he didn't take it. His drink was spiked. Ah, the Olay Speedy Beer Slipperoo. All my friends play this trick on each. It's hilarious. I'm a nurse. I had a kid once who I needed to get a urine sample from. He was 8. I gave him a cup and pointed him to the bathroom. I went to check on my other patients and came back. Kid was still in the bathroom. I go knock on the door. Hey buddy, you okay in there? Sink on full blast. Yep. Everything's fine. I go back to his room a few minutes later and he hands me a bag full of water with a cup inside that also appears to be water. I pour the water out of the bag. Hey buddy, are you sure this is urine in this cup? Yay. My pee is always clear. PT is wheeled off the x-ray. I check the temperature of the so-called urine in the cup. It was ironically the same temperature as the water from the faucet. Come on little homie, you gotta do better than that. Do you think he was just scared? I was a pretty anxious kid and did silly stuff like this out of anxiety. What do you think? This one is sad. From my old roommate. Girl had a very large lump on her breast that she didn't tell the doctors about. She actually went to the hospital for migraines, saying they were getting increasingly bad. When they found the lump, they asked why she didn't say she had that. She said she knew it was going to kill her eventually, but she just wanted to get rid of the migraines because they're giving her a lot of pain in her last months. This was my mom. I wish she told me. I work in a cancer center and could have connected her with the best doctors. By the time she went to the OBC her feet were swollen. Turned out to be her entire body swollen. I lived 400 miles away at the time so didn't see this until I got there. Her liver was something like 70-80% blasts. My oncologist co-worker was kind enough to present her case at a small group meeting and she was the most helpful, realistic person I had to talk to. While my mom's doc was trying to sell treatment, my friend was like, she has weeks to months. We did the treatment at mom's request. I wasn't going to deny her hope, but I secretly knew her true diagnosis from my friend. My god, she is a wonderful doctor and has the best bedside manner. I guess it's not super weird that this patient wouldn't admit this, but it's weird in the sense that it was super obvious what happened so he might as well just admit it. I used to do patient registration in the air. Two of us were wheeling around our computers and registering patients off of ambulances and getting patient information in rooms. A middle-aged guy comes in on an ambulance and my co-worker takes it. So I'm finishing up some paperwork and I go to our front office and pull up the patient tracker board so I can see what still needs to be done and a new patient pops up on the board. Chief complaint. Eyeliner pen stuck in penis. My co-worker walks into the office looking scarred. She explained the nurse asked him what happened and he said he slipped. She told him that doesn't seem likely. So he said he had an itch and thought it would help. We later found out from the nurse that he finally admitted that he saw it on TV and thought it would feel good. His 20-something-year-old daughter was with him, but she clearly had some form of developmental disability. It was all around a sad situation and I hope someone told him about sounding and he did some research on safe practices for kinks fetishes. Apparently they were both lodged in there, pretty badly. And X200B, edited for clarity, sorry lol. That they don't know how to read. I've been taught the trick of handing a paper upside down to them to see if they can read. It's good to know if they don't. So you can make extra sure they have a full understanding of their instructions instead of saying to read the details on the sheet. For a second I thought you meant people pretending they couldn't read. I find it much less weird that someone would fake being able to read. You could feel extremely stupid when you can't even read and you're talking to someone as educated as a doctor. That she could actually see. We had this lady that came into the ER at least once per month, usually cheat pain. She was 30s, morbidly obese. She had seen multiple specialists. Had her heart, lungs, GI system examined in almost every conceivable way. One night she comes in with sudden onset blindness. Not her first time with this complaint either. Last time she got a trip to the retina specialist. When I examine her I walk around her bed and she tells her friend to get her feet off the chair so I can get by. She plays it off super cool by adding, if you have your feet up like you always do, then a neuro exam. I have her touch her nose then touch my finger. Her idea of how a blind person would perform this exam is to touch her nose then wobble her hand from side to side as she touched the end of my finger. Not to mention, The near constant eye contact as we talked. I would ask a question and start moving while she talked and she would follow my eye perfectly. She was extremely relieved to find out she had conversion disorder and that her sight would be back soon. Edit. Maybe it was factitious disorder. I tend to believe all her chest pains and crazy complaints were real feelings she was having due to a number of her social psych issues. In the year at midnight it's a lot easier to tell her it is a symptom of dealing with whatever social drama was happening in her life and that her eyes worked fine instead of telling her she was lying to me for some gain. Either way she was sick and needed reassurance. She was genuinely relieved though. On the finger to nose test she touched my finger on the first try but instead of a straight line she moved her hand back and forth about the 3 inches the whole way there but directly there. My finger was probably 2 feet in front of her face. When was their last meal? They think they can fool their PET scan, end up losing money, time and over irradiated. There's an appalling amount of people who don't understand no food or drink at least 6 hours before. When I went in for my endoscopy they sent the guy in the curtained area next to me home because they asked if he'd had anything and he admitted he had coffee and water, thinking it didn't matter. The nurse got real exasperated at him, and he got real pissed but ultimately lost the argument and left. Imagine getting all prepped for that procedure, IV and all, only to find out you have to go home and wait to reschedule. And, TBH, after having all kinds of tests last year, not eating and drinking for the endoscopy was the easiest out of all the procedures I had to do. Except maybe drinking the shake for a CT scan. I'd rather do 3 endoscopy procedures than have to do another colonoscopy again. This one happened just the other day. Had a patient come in looking pretty sick. Labs and vitals said the guy was in sepsis and most likely had a bad infection. The question was where, after some prodding and letting him know the seriousness of his situation he finally admitted to the source of his infection. He didn't want to say it so he just pointed between his legs. Looking underneath his underwear revealed a smelly, red, swollen, pus-draining scrotum. Some of it was even black and necrotic. Not a pleasant sight and it looked horribly painful. He went on to explain that he had a painful lump on one of his testicles a few weeks back. He was told it was an infection, and given antibiotics. The problem didn't go away and by then he had decided to take matters into his own hands, literally. He tied a string tight around one testicle and proceeded to cut it out himself. Needless to say it became horribly infected and was going to require surgical intervention. Guy ended up doing okay. I should clarify, some might be asking, how do you tie a string around one testicle? Well, the answer is that it's possible when you only have one testicle since you pulled the same stunt years previous. Yes, he had done it before. The guy has successfully self-castrated and didn't bleed out in the process. Took him like 10 years between excisions but he got the job done. Once had a woman come in for a possible yeast infection. On exam she had a glass bottle stuck in her vaginal filled with urine. Totally wouldn't admit it was hers or explain how it got there even after we removed it. Just kept saying I think this is all a joke and you put it up there. Other than all the random things that end up in rectums accidentally. Drunk electrician with the longest drill bit I've ever seen sticking through both legs and impaling his scrotum in between like a really gross kebab. He was so drunk he thought he broke his hip. Denied owning any drill bits or for that matter having been drinking. Most common are the numerous drug tox screens we do that come back positive for something and everyone is shocked. Borderline offended it got into their system. You weren't breathing. We gave you Narcan. You started breathing again, woke up, and then deny you used a narcotic. Yeah, alright. So based on the past few comments I have read, I take it Narcan really is a miracle anti-narcotics drug. I kind of thought it was overhyped on the news, but I have zero experience with treating drug addiction. Had a patient refuse to admit he swallowed a pen, even though an x-ray showed the pen in his small bowel and we took the pen out during an emergency surgery. I'm a CT tech and I was to scan a woman's abdomen for belly pain. She and her girlfriend were there. I have to have a pregnancy test. I have to have one done. I can't radiate a fetus. I even asked none so no exceptions. She denies up and down she's pregnant, and then, after the test I did, it said she was. She denied it and demanded a blood test, since she was a lesbian and never has sex with men. Well, the blood test came back positive also, surprise. And the argument that ensued was biblical. She was arguing with her girlfriend and the nurses and the doctor. I never ended up scanning her and they chalked up her pain to her being pregnant. The look on her girlfriend's face when I said it came back positive was one I will never forget. Edit, because I've gotten this comment a lot. The woman in the room with the patient was a Sue and they had been together a long time, and the patient had given her so permission, in writing, to allow her to hear her medical information. Many of you are saying you shouldn't have told her in front of her so. And you're partially right in a way, but the patient had given her so that permission, and I did not question it. Had she not, I would have asked her so to leave the room. You can give anyone you deem necessary access, or no access, to your medical information. It's not limited to spouses. My friend rented out a room to 2 lesbians once. After kicking them out, she found about 5 or so negative pregnancy tests hidden under the mattress. We all knew which girl they belonged to. She had a guy over a lot, claiming he was just a friend. I feel bad for the other girl. She was super nice. I volunteer at an prisoner shoved a ballpoint pen up his urethra to get out of being stabbed. Ike insisted he had no idea how it got there. We spent hours deliberating how to get it out, and he just reaches down, still in his handcuffs, and pulls it out himself. Edit, you can't get stabbed if you're not in the prison, and any sort of self-harm will land you on suicide watch, which is brutal as well. Weird sex stuff though, no problem. There was a woman sent in by her family doctor for urinating some blood. We put a camera into her bladder with her awake, looking to exclude a tumor. We found her bladder full of citrus seed pits. So many of them. When asked why she put them there, she said, well, I eat a lot of fruit and wouldn't accept any responsibility for them being there. Had an elderly lady from a nursing home come in super altered. She would wake up briefly to answer questions but then would be out like a light seconds later. Usually in this case we assume it's from infection, stroke, etc. But we still ask about drug use, legal and illicit, since it can cause that kind of thing. Lady denied several times she didn't take anything other than prescribed meds. Finally, as we're about to intubate her, put her on a ventilator, since she was getting worse, we cut off her bra and out pops a little baggie with some white powder and a baby straw. We gave her some Narcan and she gasps herself awake. Even after that still took her a long time before she said, well, maybe I did take some drugs from a friend. Since then I've trusted no one when it comes to denying drug use. Edit, just to clarify, I'm not saying I think everyone is a drug addict. I'm just saying if you come in acting super out of it, you're probably going to get Narcan just to cover all the bases. Also, I'm aware that light seconds are not a measure of time. I use the phrase out like a light followed by the word seconds. Just confusingly worded, I guess. Shit, at least she admitted it after the Narcan. I'd say 90% of the patients I saw revived with Narcan and they still denied taking opiates. I might be too late for the party. Also, English is not my first language and I'm on mobile. I'm an internal medicine resident. Had a patient with sepsis that was being seen by the urology department. When I first read his clinical history, it stated something along the lines of, infected wound in the penis. Patient claims he doesn't know how he got it. So I begin my assessment and ask him about his wound. Indeed, he claimed he didn't know how it happened. I decided that the priority was to stabilize the patient and I made some adjustments to antibiotics and other meds. Well, the guy went downhill. The sepsis became severe even though he was with the strongest antibiotics we had and 2 different vasopressors. His blood pressure was through the floor and eventually he needed intubation and went to the ICU. He managed to survive after a complete penectomy. And about 2 weeks later I saw him again. Turns out the dude was trying to get his dog to lick his penis, and put on some peanut butter on it. Naturally the dog bit him. He didn't seek medical help for about 10 days before the pain and fever was too much. If we knew from the beginning that the wound was inflicted that way, the antibiotic would have been different, probably would have made a difference. I still feel sorry for that guy, but with a wound like that he is lucky to be alive. Edit. I should have said that a total penectomy is total removal of the penis. Sorry for all of you that went to Google Images. He managed to survive after a complete penectomy. Oh god, please tell me that word doesn't mean what I think it means. All the symptoms of pregnancy and 2 positive pregnancy tests. There's 0% chance I can be pregnant. I'm not married, to be fair. The patient's mother was there and this was in a very conservative country. She ended up admitting she was pregnant when we separated her from the mom. Isn't it pretty typical to separate minors and parents when the doctor is about to ask about sexual activity? I remember when I was 15-16, my mum was sent out of the room so the doctor could ask if I was sexually active. I'm a nurse, not a doctor, but it's amazing how many patients lie about how much they drink. Dude, we aren't judging you. We just want to know if we need to worry about you detoxing when you come out of open heart, or any other surgery. Eater, a lot of comments in here seem to be about your personal doctor visits. My comment was very specifically referring to major surgery. All I am saying is this: if you're going to land in the hospital for a significant amount of time and you're an alcoholic, it is to your benefit and safety to be honest about that, because the odds that you will withdraw in your time there is high. If providers know, they can plan to manage that so you don't withdraw. Last, sounds like a lot of you have run into shitty, judgy people in healthcare. We aren't all like that. And even the judgy ones really don't want you to detox on their shift. I can literally smell the smoke on your clothes and breath, see the nicotine stains on your fingers, and you're trying to tell me you quit smoking 10 years ago? I've never smoked in my life, but unfortunately I had a roommate many years ago who smoked daily. During this same time period I also experimented with self-tanner. I went to a patient first once and was accused relentlessly of smoking because I smelled like smoke. My roommate apped, and had nicotine fingers. Self-tanner. It was honestly one of the most humiliating experiences of my life because nothing I could say would change this physician's mind, despite my anti-smoking stance. Had a patient on our service for a heart failure exacerbation. We weren't sure why she had one now as she had been stable for a few years prior. She also had a documented past use of crack cocaine, so we checked a urine drug screen. The screen was positive and the next day I rounded on her. She asked me why she had the exacerbation. I told her it was likely due to her cocaine use. She was shocked that I would accuse her of using. I brought up her positive drug test and she insisted it was a false positive and told me she must have picked up the false positive from a toilet seat. That's not how any of this works. Not a doctor but my husband. He had a 17-year-old girl with abdominal pains come into the ER with her mum. Turns out she's in full-blown labor. Assures them she can't be pregnant, she's a virgin. The baby is literally crowning right there in an OH maternity ward in their hospital and she was in advanced labor when she arrived, and she still insists she's a virgin. Edit, poor wording. My husband was the doctor, not the 17-year-old girl. My patient presented over several months with recurrent huge abscesses that we couldn't explain. She was in horrible pain. Had to stop working. We tested for everything. Eventually her husband called me that he found syringes in her medicine cabinet. We think she was injecting herself with fecal matter. When the syringes were found she stopped coming to her appointments. To those asking why, I think she has Munchausen syndrome. She wanted the attention from being sick. I started getting suspicious when she always would get a new abscess before any court dates, CPS problems, and need a doctor's note to get out of it. She denies everything and it's very hard to have someone committed unless they are acutely suicidal. Not a doctor, but worked in a hospital for a long time. Had a PT come in that had OD on heroin. Was able to get him set on that front. However he had necrotizing fasciitis in his pectoral from injecting there. He was septic and honestly a bit of an asshole. He kept trying to tell us the reason he was there was because of a motorcycle accident. We all knew but he was in absolute denial. He eventually heals up and transfers out. After a couple months. He came back about 6 months later to say thank you to all of us and to apologize for all the lies and the sholish behavior. Seems it was enough to get him out of that life and onto a new one. I think about him now and then and hope he stayed clean. Not all that uncommon with people who have heroin addictions, or most any substance use concern, to deny it's why they're in the ED. Often an OD is the turning point for many, but the initial visit can still harbor a lot of shame and ultimately denial before some work it out over the next few weeks and months. Staying sober without proper support can be incredibly difficult, however, so I hope he has found that support. Not a doctor, but a nurse. When you come into the hospital wanting to detox, and I ask you how much you drink, please stop lying to me. Withdrawal from alcohol is nasty, but I can make it a little more bearable. If it's 2 bottles of vodka a day, tell me so I can medicate you accordingly. You'll thank me later when you aren't having a seizure. 2 bottles of vodka a day. How long can the liver and kidneys actually deal with that abuse? I only ask because after seeing a guy in his mid-30s buy a bottle of vodka, bottle of whiskey and some beers at 11 a.m. Cost him over $80, I had no idea how much an alcoholic actually drank or spent. What a horrifying disease. When I was a medical student, we had a patient on one of my rotations that was getting oral pain meds but insisting that we switch them to a stronger IV pain medicine because they had been getting nauseous and vomiting up all their meds. When our team rounded on the patient to check on them, we walked into the room and were quickly greeted by an eager patient that had been waiting to show us their vomit bag. Turns out that it was filled with a lovely mixture of piss and shit and topped off with a handful of pills the patient had thrown in there to make it look like they couldn't keep the meds down. When we called them out, the patient was in total denial and tried to reason with us that it must be vomit since it's in the vomit bag. How a 20-ounce glass Coke bottle was lodged all the way up a guy's rectum. He denied it vehemently in front of his wife. That was weird. And awkward. How the remote control to a Zenith television wound up in the rectum of a 54-year-old father of 2. They stopped making Zenith television sets years ago. From a medical perspective, why do you still own this remote? Only work records in a clinic, but we had a woman come in with a report of vaginal odor. All well and good, it happens all the time in an obgyn clinic. What she hadn't bothered to say was that she'd gotten a tampon stuck around the end of her last period. She'd gone through menopause 7 years prior. What the ever-living fuck? She knew she had a tampon stuck there for 7 years. Did she think it would disintegrate and come out on its own? How do you even get a tampon stuck? How did it take 7 years for it to drink so bad she thought she should go to a doctor? How was she not horribly unwell? Jesus Christ, the smell must have been awful. On my surgery rotation as a med student, warning this is gross as fuck, had a patient recovering from having parts of their bowel removed. As part of the recovery their intestines weren't completely connected to let them heal better, so the intestines were connected to a little hole in the skin with a bag attached for the poop to go into, known as a colostomy bag. For reference, this woman was in her late 60s and over 230 pounds. I had to round on her every day. And every single day I'd walk into her laying in bed absolutely covered in toxic gasoline smelling diarrhea. She also had C. diff, an bacteria that anyone in the hospital can identify by smell, dart. And she would flirt with the residents and make casual conversation while we would clean the shit off of her and fix her ostomy bag. One day we walked up to the room and the chief resident walked in the room, immediately walked back out and closed the door behind him. Looked up to all of us following him, and when she's fingering herself covered in shit. I really wish I was making this up. So yeah, she never admitted it, but obviously she was fucking tearing at all the tape covering her ostomy all night until she broke the seal and could get herself covered in shit again to get attention from the doctors. Edit. I'll answer some questions here. 1. At what hospitals do doctors have to deal with ostomies? Shitty ones. 2. What happened to the patient? No idea. After having her for around 2 weeks my rotation ended and I was relieved of my duty. 3. I can't think of any more poop puns. 4. I did not witness the fingering, but I believe the exact term that was used was fucking flicking her bean. 5. She was not mentally disabled in any way and was completely alert and oriented. She wanted attention from the doctors. One resident in particular was her favorite, and figured out how to get it 6. Why didn't the nurses deal with it? I have no idea. I was a brand new third-year student on my first rotation and just figured that's the way things were. After the first week the attending was even coming to the room to secure the ostomy since it kept coming undone. Dunno where this is coming from, that people are saying only nurses deal with ostomies. Oh no 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 no. I have a ostomy. I was wondering why she was covering in shit every day. That doesn't happen unless something is wrong. Not a doctor, but many years ago was working as an assistant to an occupational therapist. We got a call out to help mobilize a woman who had been morbidly obese and was told to lose weight. We learned from the daughter she had gained weight, but her mother would refuse to come clean on what she was eating. All the daughter knew was that her mother may have been eating deep fried food due to the vast amounts of cooking oil she found in the pantry. When we arrived, she had gained an extra 6 kilos but insisted she had lost weight. She did not look it. Before we began mobilizing her and check her living room for trip hazards, she also had horrendous knees. We took a look at the pantry. Olive oil, peanut oil, sesame oil, any kind of common cooking oil you can find off a supermarket shelf. She had it. A vast stockpile of oil. We asked what she was frying with the oil. She insisted that she wasn't frying anything and that she was eating healthy since the oils she used were healthy. We had to explain to her that oils are still fatty and will still contribute to weight gain. After a bit of poking around the pantry, I noticed that for the amount of oil she had very little in food that could be traditionally fried. She also had little in other foodstuffs that could explain the obesity. I brought it up with the therapist and the therapist then demanded the truth. We couldn't provide complete health care until we knew everything. She admitted that she thought healthy oils would help her lose weight and suppress the appetite, so she had taken to drinking the bottles of oil whenever she got hungry. Needless to say, we disposed of most of the bottle of oil and set her up for a home visit with a dietitian. Not a doctor but working in a. One day some pretty young parents brought their toddler in because he was super lethargic and not responding to any stimuli, and the parents said they had no idea why. The staff were pretty concerned for him, because those symptoms are a pretty big red flag for small kids. So we start running a bunch of tests including a drug screen which ended up being positive for THC. The doc goes and talks to the parents about it and they finally broke down and admitted that the kid had eaten an entire bottle of their weed gummies while they weren't paying attention a few hours earlier and was just high as shit lol. Had a woman on my obgyn rotation during med school that had pelvic inflammatory disease with bilateral abscesses around the fallopian tubes requiring drainage and IV antibiotics. The cause? Well, she never admitted to it, but we believe that she was repetitively using and washed sex toys to pleasure herself for weeks based on the culture that grew and her story not adding up. Clean your sex toys. Before use, after use, as part of spring cleaning. FFS, it's not hard. Trauma surgery rotation. Surgeons are helicoptered out to the scene where a man is impaled on a tree. They are hoisted up to cut him down in conjunction with firemen. The man, the branch lodged deep in his ass, and the surgeons return on helicopter. In the ED, straight to CT4 pan scan. It's in there, as in through his glud max, med, minutes, pelvic area, and the tip of this branch is lodged somewhere alarmingly close to the bifurcation of the iliac, external and internal. He's hemodynamically stable and talking. Saying my ass, I need meds. The doc is like, no shit. Asks him what were you doing in the tree. His answer, I used to trim trees. Okay, but were you doing that today? No, but I used to trim trees. You tox is positive for meth, but it's time to get that baby out, so it's stat for IND and xlap, itch. I get to scrubbin' and see what it's all about in the ore. The branch is indeed lodged between the iliac artery and vein, at the bifurcation. Neither vessel is damaged. We proceed to remove wood chips and bone chips from the enormous hole we have excavated out of his ass, and no suturing practice for me because it's a wound vac for this man, who used to trim trees. In the following days he is in and out of a med-induced haze. We ask him over and over, yo, but what were you doing in the trees? His reply: I used to trim trees. He came clean about the meth use and other drug use. He started to look better and better as he basically detoxed before our eyes. He eventually left in as good health as one can be with a giant mass of granulation tissue where your ass used to be. Never told us why the fuck he was in that tree. I have told this story before on Reddit, but not for a while. A story that resides at the nexus of oncology and psychiatry. Middle-aged man enterer in sweetpants. Worked as an accountant but currently unemployed. He tells me that a urologist had diagnosed him with inflammation of his epididymis 3 years earlier, but he hadn't followed through on the treatment, and that he now wanted to get things taken care of. During the physical exam I see a grapefruit-sized mass in his scrotum. It was not subtle in any way. I call a neurology and order a CT scan. I tell the guy that this isn't inflammation, it is a tumor and we need to do more tests to find out what type of tumor. He stops me and tells me he didn't understand what I had said. Could I please repeat it? Then he pulls out a pad of paper and writes down my exact words and sits there staring at the words for a few minutes. I just felt really sorry for the guy. Not the doctor, but patient. Doctor asked me during a physical when my last test for gonorrhea and chlamydia was, and never asked whether I've been sexually active. I'm a virgin. My doctor was cute, and for some reason I felt embarrassed to admit I haven't had sex, so just rolled with the recommended urine test, $250 plus, and the expected negative results later. I felt really stupid. Looking back, pretty weird thing to not just admit. My doctor couldn't care less what my sex life was like. Would have saved me some money. Yikes. Edit: I'm male. Not sure if that provides useful context or not. This was a routine, non-symptomatic physical. I get yearly physicals, have never been asked to take an ST test before, and was asked this time if it'd be okay that I get tested. Fondle and cough was not performed at this physical, so opt-outs were definitely in season. I had a doctor not believe me when I said I wasn't sexually active and a virgin. I came in for dizzy spells and he was insistent that I must be pregnant. I said that wasn't possible, I've never had sex. He said, there are other ways to get pregnant. I said, what, like from a toilet seat? You've got to be joking. He said, are you sure you can't be pregnant? I said, semen has never come into contact with my vagina. The fucker still sneakily dipped a pregnancy test in a urine sample I gave for something else. A few days later a nurse called me to tell me I was not pregnant. Shocker. So in my story, I am actually the patient not telling the doctor something, but I felt like it was good enough and relevant enough to share. But when I was like 13 or so I ended up with a urinary tract infection, which was odd because I am a guy. I ended up having to go to the children's hospital and had to go through all this stuff to try and look at it and fix it and whatever doctors do for a UT. What I didn't tell them, and still haven't told anyone except my wife, was that this happened because I was curious what it would feel like to shoot water up my dong with a hotel shampoo bottle. Not great. But if you pump air up there it makes a mini fart sound when it comes out, so I guess that's a plus. Hey man, 13-year-old me use the pressure washer setting on a shower head to shoot water up my penis. It would cause the most intense orgasms I have had to date and would last as long as I held it there, so often several minutes. Blood in my urine was a bit of a turn off though. Usually don't mention it because I am afraid some dummy will try it, but I will assume you have the sense not to. Not a doctor, yet, but was volunteering in the emerg ward and a woman came in with her pregnant daughter. Not only did she refuse to believe her daughter was pregnant, but was feeding her laxatives to deal with the extra weight. It was pretty horrible stuff. Not a doctor, but this happened to my friend. My friend was in a really awful car accident. She was hit head on by a huge pick-up truck that was going 83 miles per hour in a 40 miles per hour zone. The driver had passed out at the wheel. When police arrived at the scene, my friend had a punctured lung and several broken ribs. The other driver was unscathed and still passed out at the wheel. The police found open alcohol containers, marijuana, and other illegal substances in his vehicle. He didn't wake up until the ambulance had already arrived at the hospital and he was inside. The doctors, who had been informed that he was under the influence, asked him if he remembered anything. He told them, "I have low blood sugar. I must have passed out," and then they did a drug test and found he had been using everything they found in his car. Real late here, but I am a nurse and we just had a patient, mid-50s male, strictly pooped in diapers. When asked why, he said so he can freeze them. Ends up he has a deep freezer in the garage full of poopy diapers. He also works for housekeeping in the hospital. What was he planning to do with the frozen poopsicles? Catapult them at a neighboring village as part of a war tactic. A few years ago I had one kid, maybe 16 or 17, who evidently had heard of a challenge where you can fully insert a light bulb into your mouth, but when you try to pull it out you can't open your jaw wide enough and the bulb shatters inside. Well, after about 3 hours of picking glass from out of his mouth, in every spot imaginable, gums, under the tongue, roof of the mouth, throat, etc., I asked what went down and he just would not admit that he put the light bulb in his mouth. His main story was that his friend must have slipped it in his mouth when he was sleeping and punched him in the jaw. However, upon talking to this friend in another room, he confessed that the boy had tried to beat the challenge. His friend even showed me videos of other people trying it. So I go back in with the patient and bring his guardians in this case an aunt and uncle, and explained the whole light bulb challenge without giving his friend up. When asked what I was talking about, I explained and said there are many videos on the internet about the exact thing I'm talking about. They also revealed that he had tried several dangerous stunts and challenges before, but even still the stubborn bastard wouldn't admit a thing. He was adamant that he had absolutely no part in his injury and that everyone was out to get him. It's just crazy to me how arrogant and thick-headed some people will get. They'll do anything before admitting to doing something that's stupid and short-sighted. I'm vet student. Many clients like to say I don't overfeed my dog cat, that's just their normal size. When their pet looks like a watermelon. And here I am taking one of my cats to the vet because she's too fat, but we can't figure out why, i.e. we follow feeding guidelines using vet recommended food and the other cat is a healthy weight. I had a patient who came with his boyfriend. He had severe abdominal pain. He claimed it started when he had a difficult poo. Tests showed he'd ruptured his colon and it turned out it had happened using toys during sex. To me it's weird, because he'd introduced me to his boyfriend, so it's not like he needed to hide his sexuality. I'm a doctor of dental medicine. You all fucking lie to me about flossing. One guy who swore he didn't know why he was losing his teeth because he was brushing twice a day caused me to get heated. I have him a mirror, scrapped a chunk of plaque off his teeth from his gum line and showed him a big heaping pile of plaque proving that he was not brushing. I gave him the benefit of the doubt and told him I would show him how to brush, and he turned it down because that couldn't possibly be it. Some people just want dentures as fast as possible. Kind of the opposite situation, but I had to go to the ER because I couldn't keep anything down and I was dehydrated. Doctor asks if it's possible that I'm pregnant and I said I am sexually active, but I just finished my period, so it was unlikely. She just stared at me for a second and started laughing. Apparently no one ever just admits they have sex and always tried to hide it, for some reason. Turns out I had a kidney infection anyways, lol. I went into the ER because I was 8 weeks pregnant and bleeding with lots of pain. Was worried about an ectopic. Got asked what my chief complaint was, described the above. Then got asked if I was sexually active recently in the same conversation as they were filling out their info. I was so confused, as if they didn't just hear me worrying about ectopic pregnancy. Starting residency this week. I posted a while back but will post it here again. It wasn't super obvious at first, but after looking into her records it became clear. So this happened on my psychiatry rotation in medical school, not currently in a psychiatry residency though. There was a patient at an inpatient psychiatric facility for suicidal ideation. She constantly insisted that she had a mass on her breasts and demanded to be physically examined only by male doctors. When the psychiatrist I was rotating under declined to perform a physical exam, she asked me to do it during my daily patient interview. I also declined physical exam, but had a bit of a hunch to check her medical records. It turned out she had an ultrasound done a week before that found only normal breast tissue without masses. However, apparently this lady had frequented many doctors' offices with various complaints of an unspecific nature and would usually focus on breasts or vaginal complaints when she visited male physicians' offices. We diagnosed her with factitious disorder, formerly known as Munchausen syndrome, and histrionic personality disorder. It seems her goal was mostly attention from medical professionals. She had lots of issues, but we also had to be careful to make sure she wasn't fishing for a lawsuit. Patients like her are why doctors document everything meticulously, so the patient wouldn't admit to making things up all the time. According to the psychiatrist I was working with, she didn't actually believe any of her health problems exist and her primary goal was the attention from medical professionals. If she actually believed she was sick, we would have diagnosed her with illness anxiety disorder, commonly known as hypochondria. FNP here, had a first job out of school doing Medicaid risk assessment for insurance companies. I basically had to do complete family social extensive reviews and complete pay and head to toe and make any new preliminary DX and referrals for the insurance company in 60 minutes. Very taxing, but it definitely helped me hone down my skills in getting information from patients quickly and efficiently, and especially with my charting. But that's a different issue. I have this one patient, and doing my thing getting their family history, etc., and get to drugs and alcohol use. Normally pretty good disclosure about obvious things, especially if they are being treated for things like alcoholism, etc. I get to smoking history and expect to hear 20 ppd for 15 years given the smell in the house and the open blunt on the table that was pretty clearly going to be rolled before I arrived. Deadest woman with a 10-month-old on her lap looks me in the eye and says no to any and all smoking history. I stop and look at her in the eye and say, "Are you absolutely sure?" "What's this?" Points to cigar blunt opened. "Yay, that's not mine." "You live with a resso at all or roommates?" "Number." "Oh, okay." I had gone over myself, imposed time limit on that charting section, so I just wrote down no in the chart and had her DX and referred for tobacco and drug abuse. I wasn't about to argue with a woman who couldn't admit an issue so clearly right in both our faces. Radiologist here. I've seen lots of weird things, but the weirdest someone wouldn't admit was the trauma patient, female, who got pan scanned because she was altered. I saw a cube of gas and debris in her vagina which did not look like a tampon normally would. After some thinking, I figured it was either some drugs she was trying to hide or potentially some weird foreign body. I advised the trauma team to investigate. They were not comfortable, so they consulted the gins. They sent a first-year resident who asked the patient if she had anything in her vagina. The patient denied anything. The gins reported back to trauma, who reported back to me that she denied anything there. I advised a direct visual examination which occurred finally an hour later, at which time they found nothing. To this day I have no doubt she had a leprechaun in there. TLDR, don't send a first-year resident to do uncomfortable things without explicit instructions. That they had maggots in their foot wound. Patient with diabetes came in to see me in clinic. Said foot had a wound. I asked when they last looked at it. They said that morning, and this was an 11 a.m. appointment. Helped them take off their sock. There were 4 maggots busily cleaning a pretty large ulcer on the side of the foot. I threw up a little in my mouth and proceeded to remove the maggots and dress the wound. A damn clean wound due to those maggots. Med student. Went to see a patient for my practice physical. These are all volunteers and we don't get charts or anything, just a slip of paper with their name and chief complaint. I walk into the room and this older gentleman is holding his cup of coffee and didn't shake my hand, which threw me off guard. Then I noticed one of his hands was much weaker and kind of scrunched up and he didn't move it. So I asked him about it and he was like, "Nah, it's fine." See, and proceeded to move it like a 1/2 inch. It clearly was not fine. I'm sweating now cause these are mainly just opportunities to talk with patients and they're supposed to be a breeze, but this guy looks like he had a stroke and had no idea. Turns out he was just messing with me, but I was ready to call in a real doctor cause I was freaking the fuck out. Edit. The dude really did have a stroke. It was 15 years ago and only affected his one arm. He just liked to pretend it was fine. Once he made that clear, the rest of the history physical was great. Heh, I was an SP for a couple of years at the medical school. Had some good fun, although we were told not to fuck with the students because it would impact their learning. Optician here. A few days ago a man called asking if he could see an optometrist ASAP. I told him we had no spots left and asked him what seemed to be the problem. He told me he felt he had an eye infection and it's been 4 days since he can't see properly from his left eye. Sometimes clients can complain from over-tearing or swollen eyelids, but no. He told me part of his field of vision was off for the past 4 days. We have indicators, such as flashes of light or dark spots, that tell us if we are dealing with an emergency worthy of being sent directly to the hospital for emergency intervention from the ophthalmology department, and this was clearly it. I told him he has to go to the emergency room now. He tells me he has a busy shift at work and is a supervisor. I told him again to go to the hospital ASAP and to take it seriously. He tells me that he can't because his day will be scrapped. I told him to stop putting work over health and that this needed to be dealt with now. He still argues with me and tells me that he doesn't feel like waiting in the emergency room for hours. In any case, if you have symptoms resembling a retinal detachment, you are seen almost immediately. I insist that he must go. He then tells me I'll go after my day shift. I tell him to cut it out and go. He then asks me if it's an emergency and to tell him what he has. Given that I'm not allowed to give any diagnosis by the phone, I told him to hurry to the hospital. He told me he would, and I'm pretty sure he stuck to his plan of finishing the day. Retinal detachment can usually be treated if noticed quickly. Not a doctor, but I work in a big, busy hospital. We had a 20-ish-year-old obese woman come in complaining of severe abdominal pain. Before she was even examined, it became clear that she was about to give birth. Side note, my hospital does not have labor and delivery, that is at our other campus a couple of miles away. This woman proceeded to give birth to a full-term 8 pounds healthy boy in hour and denied that she was pregnant and denied that the baby was hers. The placenta was still in her umbilical cord, not cut. The doctor said it's a boy. And she said that's not my baby. Okay. Needless to say, psych was called along with a team from the other hospital to take the baby over to their campus. I often wonder about that baby, and hope he is doing okay. Hopefully the mom put him up for adoption and he ended up with some great parents. My ex-husband's cousin got pregnant in college. The guy was in a fraternity, she was in a sorority. She hid the pregnancy. Keep in mind this university is in the same town where she grew up and her parents and family live here too. She ends up being taken to her by her mother. Extreme abdominal pain. Yep, she was in labor. Gave birth. Was in complete denial. Rejected any idea that she gave birth. The family had her agree to name it after her father and brother. Thankfully she immediately put it up for adoption. The baby was immediately adopted into a healthy, loving family. Ex-husband's cousin recovered-ish. She's almost 40, working as a waitress part-time for fun. Her parents still pay for her condo, car and bills. She's Peter Pan syndrome and refuses to grow up. Everything is now unicorns, pink glitter, coloring books, etc. I am sad for her but thrilled for her baby. Maybe not so weird because the person was whacked out of their mind, but once had a patient who was clearly on drugs and vehemently denying it. I'm not a doc, but I'm a lab tech and draw blood in the ED regularly. While I was drawing their blood, the patient was screaming at me to stop letting the green men that were coming out of my arm touch them. Turns out, they were tripping balls, but underage and refused to tell us anything for fear of their parents finding out. Patients lie about the most mundane things. They will tell you they don't smoke cigarettes when you can smell it all over them. You can see a pack in their purse, and you physically saw them smoking outside before they came in for their appointment. That's not what annoys me though. What annoys me most is that patients will Google what they think is their diagnosis, admit they did get their diagnosis right, then argue with you about the recommended treatment and deny having read that also. The classic example is bronchitis. Patients will Google it, read the Wikipedia article, then still come in and demand antibiotics. When you confront them with this, they will pretend they didn't know that they read that antibiotics do not work. They do this with almost any disease in which the treatment is conservative management, and yet they will still come in asking for treatment that has no evidence. If you're going to become an internet expert, don't do it 50% and deny you didn't read the part about treatment. Edit. Roughly 80% of what comes into urgent cares can be managed at home with do nothing, rest, drink fluids, take Tylenol. I work in pharmacy and so many people come in bitching that their doctor didn't give them antibiotics for some that doesn't need antibiotics, and it drives me nuts. For once a doctor has done the right thing, because way too often they just give them to shut the patient up, and now they are getting bad-mouthed for actually doing their job. Needed to do a drug test on a patient, who came in with his pregnant girlfriend. Guy goes into the bathroom. A few minutes later he comes back out with an empty cup. He goes back to his room to drink some water. Couple minutes later he hurries back over to the bathroom with a noticeable bulge in his pants pocket. He comes back out with an adequate sample. So, we run the test. It comes back negative. We then run a pregnancy test on the sample. That comes back positive. Dude denied his pregnant girlfriend provided the sample even after being told there can possibly have prostate cancer if his urine turns positive on a pregnancy test. It was unbelievable. I am a doctor. Not a single random thing up my ass is weird to me anymore. I've heard or seen it all. Nor is it that surprising when somebody is wacko enough to claim they got Lyme disease sexually from their husband, who got it vertically from his mother, and that's why they are sterile. If you aren't aware, this is bonkers. The actual weirdest thing for me was that one time when a severely obese person just refused to admit they ate anything but one small salad a day. It just comes down to math. You cannot get up to 500 pounds unless you put 500 pounds of stuff into you, at a decent pace. Plus we found a snack wrapper in the inaccessible folds of your penis. Jeebus. Plus we found a snack wrapper in the inaccessible folds of your penis. Jeebus. Jeebus is an understatement. I don't know how I got these syphilis ulcers on my penis. My wife and I only have sex with each other. Patient refusing to admit he is continuing to drink water despite being on fluid restriction for congestive heart failure. He would take a rag, soak up a bunch of water, put it on his forehead as if to cool down, and then squeeze the water out so it would run down his face and into his mouth. Doc, I just don't understand why my weight won't go down. This is water weight we were monitoring, not fat weight. In a heart failure patient, you try to find a weight at which her heart function is optimized, and then aim for this weight, which over the short term of a couple days, is largely reflective of the amount of fluid water in the patient. Very odd. We wondered if it was almost subconscious. Not a doctor but a nurse. I had a patient that kept giving herself chlamydia repeatedly from using her vibrator once she'd been initially infected with it from a random partner. We asked her about any other partners and toys etc. She denied until she couldn't anymore. I first got on this Reddit post 5 hours ago. Somehow I ended up down the Reddit hole reading about cum roaches, Jolly Rancher gonorrhea, squid masturbation, etc. God help me. A patient came in due to abdominal pain. Though we're thorough in our examinations, some parts are omitted for obvious reasons. One doesn't check teeth for abdominal pain, or check one's balls for a complaint of edema. Initial consideration was appendicitis. A few hours later, the patient's wife came up to me and whispered, "My husband is feeling a little timid to mention this, but he feels that one of his testes is a little bit sore." I went to take a look and his balls were swollen to the size of a grapefruit. Turns out the patient had an incarcerated hernia affecting his lymphatics leading to third spacing. That dude was taken straight to the OR. I'm not a doctor but I work in the hospital. We have a regular at the ER. She comes every single day. She figured out that we can't send her home before a doctor examines her if she complains of trouble breathing or chest pains. So she always does this. No ward wants her to come there and no doctor wants to be responsible. She's super manipulative, treats the nurses horribly and is very demanding. She is a opioid and benzo addict and usually wants more drugs and someone to take care of her like she's at the Hilton. Her goal every visit is to get admitted. She succeeded a few days ago, when there was some issue, self-inflicted, with her colostomy bag. To avoid being sent home she smeared shit in her IV trying to cause sepsis, just to stay at the ward. Had a 20-ish guy in the ED come in with excruciating chest pain, and looked very uncomfortable. Denied any kind of trauma. Turned out he had a fractured sternum. When I told him we figured out why he was having pain he said, "Oh yeah, I forgot I overdosed yesterday and my friend gave me CPR." Patient came in with an irritated ostomy. Turned out to be insti. She refused to admit she was using the hole for any sexual activity. This is the second one of these in the thread. Fucking nasty. I guess literally. That they can't afford their meds. Yep, America. It's so weird, we can for sure tell you weren't taking them. It's put your life in serious danger and if you don't fess up it could kick you off the transplant list for non-compliance. It's such a taboo I guess to say you're poor. You had to pick lights or meds, food or meds, gas or meds. It sounds so simple doc, I just couldn't afford that and food, but it takes some work sometimes to get people to just tell us. Yo, this right here is some serious shit. I was recently in the hospital due to a DKA. A lot of people would think it's because I wasn't taking care of myself, poor diet due to lack of funds, but the main reason was because I couldn't afford my insulin. My insurance doesn't cover the whole cost, so I pay the difference, and it's expensive. Always let your doc know if you can't afford one of your meds. It's amazing how many patients receive Narcan, but have never used opiates. Narcan only reverses opiates, no other class of medications. They come in with shallow, infrequent respirations, pinpoint pupils, and sometimes needles and heroin or pills in their pockets. We Narcan them, they wake up, then deny everything. Denial is also a hell of a drug. The drugs in their pockets are never theirs. Sometimes, they're not even their pants. They walked outside pantless, found a pair of pants in their size, never checked the pockets, ended up not using opiates, received Narcan, and those pants somehow happened to have heroin in them. Amazing. Also had someone walk in with a bullet in their butt, adamantly deny there was a bullet in their butt and they weren't shot. Not a doctor but work in a radiology clinic. People always lie about having fasted for their appointments. They'll come in for their abdominal ultrasound and say they haven't eaten. You are literally holding a bag of McDonald's, sir. Moral of this thread. Don't lie to your doctor, you're only making the situation worse. We had a guy at the VA hospital in urology who complained of a white urethral discharge, had many tests, we couldn't figure it out. Multiple visits later, he was admitted due to urinary obstruction. It turned out he was squeezing toothpaste into his urethra. Not a doctor but friend of a patient. I had found her in the bathroom after an attempted suicide. When I found her, she was drifting in and out of consciousness. En route to the hospital, I had called her parents letting them know about the situation, and to my disbelief, they wanted me to lie and say that she had forgotten that she had taken too many pills and that's why she was non-responsive. I refused to do so, but by the time I arrived at the hospital, they were already there and were the ones who gave an account to the Tridge about what had happened. In the air, I lied and said that I needed to use the restroom before flagging down her attending and telling him what had actually happened. Not that I had actually needed to do so because the doctor wasn't an idiot and knew what had happened by just one look at my friend. A referral was made to a psychiatrist, and by the time my friend was fully conscious again, she was sent to a psychiatric facility for monitoring and treatment. A suicide attempt is a suicide attempt. Why lie about it? Whilst I was working in general surgery, we had a 14-year-old kid come in with a small bowel obstruction. The X-ray showed this huge circular object in his bowel and we just couldn't work out what it could be, so he went in for open surgery to take it out. When we opened him up we found a fully intact water balloon, filled up and tied. When he woke up, when we asked him why he ate it, he said he didn't remember eating a water balloon. No idea how you could forget it though. There's a few references to recent bug eater. Can someone link that post? Edit. Tifu. Asking for the bug eater post. Time to bleach my brain. Tofu by eating bugs my entire life and having a spider bite the inside of my mouth. Tofu webpage. When I used to work in a Navy, we had a woman who came in complaining of abdominal pain. She'd only speak to the nurse, and I soon wheeled her over to radiology to get films of an obstruction. No one was given any information beyond that. I soon found out why. The rad tech took a couple of shots and we saw it. She'd lost a phallic-shaped object up there. When partaking in anal play, use toys with either a bigger base than the toy or some other type of retrieval method. She tried a few shots, but couldn't get a really good image of it. Finally, after the third shot, the rad tech stomped into the room and said, "It's still on, isn't it?" It was 3 a.m. The tech had worked all day and was woken up to take the films. Was it Ted's mom who said nothing good ever happens after 2 a.m.? The patient sat up as straight as she could, held her head high, and said, "I have no idea what you're talking about. How I finished that shift without passing out laughing, I'll never know." This happened when I was still in med school. One time I was doing my gynecology rotations. My doctor and I encountered a 37-year-old female accompanied by her husband complaining of lower abdominal pain. After having a look at it, the cause was pretty obvious. There was a fist-sized bruise on her left ischial spine, the rim of her hip, and from the looks of it, black, deep blue and a dark brown diffusely spread out. It was pretty fresh, not older than a day or two. I had a literal brain spasm and was about to accuse the husband of domestic abuse when my eyes met with my doctor's. Instantly I knew she was more qualified to handle the situation than I was, and I decided to keep my mouth shut. She proceeded to examine the area and asking basic questions while carefully palpating the area. She then asked her patient to undress so that she could do an overall assessment and to get a better picture of what she was dealing with. After some initial reluctance from the wife, her husband managed to convince her that it was in her best interest to let the doctor examine everything. My jaw dropped. There were bruises all over her upper abdomen, stomach, back, inner thighs and buttocks. Her breasts were practically lumps of red inflamed tissue with blotches of bluish black. Every part of her body that could be covered with clothes was covered in bruises in different stages of healing. I have seen my fair share of gruesome things in my life as a doctor, but this one image has stuck with me simply because the women had looked perfectly normal and healthy. My doctor was also noticeably disturbed by what she saw and asked as to how she managed to injure herself. To my astonishment, the women claim she slipped from the stairs and fell down a flight of stairs and hit herself on the handrail. This woman had tracks along her back which were definitely inflicted by a belt of sorts. And even after a good 20 minutes of going over most of her injuries, she wasn't ready to claim otherwise. Meanwhile, her husband grew more and more restless and there was a worried look on his face. The doctor then asked both me and the husband to leave as she needed to do a gynecological examination and she needed to do it alone with the patient. If you ever did your rotations in med school, you know that doctors almost never ask students to leave as we somewhat become a part of the ambience. Always there and learning. I instantly realized she needed to establish trust with the patient one-on-one and needed the patient to be comfortable. I head out along with the husband and we both stood on opposing ends of the corridor. The husband, now visually disturbed, seemed to want to talk to me. I thought to myself, serves him right, and a whole lot of profanity. After about 5 minutes of awkward silence, he finally decides to move closer to me and says, "Hey, can I speak with you for a minute?" I am now obviously angry and the guy and throw a quick what glance at him. "Can I say something to you that you can pass along to the doctor? I want to tell you what really happened. I just want wife to be healthy." Now he had my attention. He proceeded to tell me about their marriage of 11 years and how happy they were until about 6 months ago. He told me that she had taken a liking to BDSM and had been increasingly asking him to inflict pain on her in various ways. When he was outright against it, she would insult him and his parents and call everything he held dear whatnot, sometimes for days at end, until he literally couldn't put up with it and gave in to her demands. About 2 months ago, when he said he wanted a divorce as he was done with all her bullshit, she showed him pictures of her bruises on her phone and threatened to sue him for domestic violence and send him to jail. She had effectively trapped him. But last night was worse than every other time. She apparently forced him to punch her multiple times over and over until she almost passed out. He asked for what we could do to help her heal. I looked into his eyes. He was crying where he stood. I went in and pulled my doctor aside and told her the entire story, and they did an ultrasound and found out that she had a reputed ovarian cyst and that she needed emergency surgery and underwent an oophorectomy, and the couple were referred to a psychiatrist and a couples therapist. I don't know what happened to them after that, but I sure hope the guy got out of that toxic relationship. TLDR, BDSM fetish wife traps and forces husband to hit her, ruptures her ovary, undergoes surgery and has it removed. Not a doctor, but I work with people occasionally in a hospital for other reasons. Criminals. Anyhow, one day I was sent to pick up a woman for transport to a different facility, and she was being treated a host of different things. She has complained of a lot of pain in the area where her colostomy bag was attached. I believe it's called a stoma. Again, not a doctor. Long story short, she was diagnosed with a host of things wrong with the stoma, and the doctors were all guessing how the hell she had gotten some of those complications. She eventually admitted to me and the rest of the room that she was still engaging in her lifestyle of a prostitute, and men would pay extra money to make sweet love to the hole where her colostomy bag attached. TL. Doctor, for enough money you can make love to the hole in the side of someone's abdomen. Just glove up so you don't give her an STD there. Jesus Christ, Reddit. 2 STDs in a stoma stories on the first fucking page. A friend's mom wouldn't admit my friend had scoliosis. Does that count? This one is extra stupid because you can literally fucking see their spine isn't straight from looking at them. I am an RN, but I've had patients lie about not pooping because they are worried about a suppository. I make sure to go full worst case scenario about bowel obstructions, impaction, emergency surgery, etc. It normally makes them follow my directions, take doctor ordered bowel meds, order certain foods, drink fluid, walk if able, etc. And scares the shit, out of them. Not my story, but a fellow co-worker's story. This 360-pound woman came in, wheeled in as she was in a wheelchair since walking was so difficult due to her weight, complaining of severe stomach pain and itching. They took her in and started examining and asking questions. As she's talking about the area that's in pain, they lift up a heavy roll of fat and there were 2 Twinkies squished in there, all moldy and almost necrotic smelling. It was apparently there for nearly 2 months. Want to know what was inside those Twinkies? Maggots. Hundreds of them. All of her pain was caused by the maggots trying to burrow in her necrotic skin, left untreated. We believe she put the Twinkie there so they would eat the Twinkie and not her necrotic tissue. She denied that she left them there and has never eaten a Twinkie in her life. Kept going on and on about someone had stuffed them there while she was asleep. Apologies if this is not well written, I am quite tipsy and on mobile. Not a doctor. Family member is a psychiatrist. Told me that patients won't ask for a new doctor psychiatrist even if they hate them. I mean, come on, this is about you. The doctors probably deal with worse shit a dozen times a day, and you asking for a switch isn't going to make their day that much worse, maybe even better. Just tell the absolute truth. It's hard when you have to stay at the practice. I chose a doctor I like because she has a practical specialty in my disorder. But for some reason I found myself seeing her dick of a PA. I asked to be scheduled with her. I see him. I ask to make sure I see her, and to make sure I don't see him. And I still arrive to find that I'm scheduled with him. So then I have to go to the front desk and explain that I don't ever want to see him again because he's a prick that doesn't listen. And the 2 staff members there just stare at me. It doesn't help that I know people have chosen not to see him because of his heritage, and I don't want them to think that's why, but really he's just an idiot that is endangering my health by not listening, and I can't risk it anymore. Circumstances won't let me leave the practice, so now I have to dodge him monthly for the rest of one of our lives. We caught a mother of a patient injecting poop in his son's veins. She obviously denied she could do so, because her and his son were well known in the hospital, so she gained the trust of the nurses. She was arrested and diagnosed with Munchausen syndrome by proxy. The poor baby is alive but with development problems. Volunteering as an RSO and medic during my local range club's open weekend. Dumbus rested the barrel of a 10-22 on the toe of his boot for a picture and shot himself in the foot. Claimed it was a sniper. I told him that the entry wound was straight through the top of his boot and asked him where shot came from. They must have a stealth chopper. We need to call the cops. You were inside when it happened. I saw you do it, fellas. Don't do bath salt. I had a patient who came in for a corneal abrasion from getting crack in his eye, was still holding the crack pipe, and claimed that he didn't smoke crack. Young girl refused to admit that she had sex or any sexual contact. She was pregnant. In the end we found out she was raped. Actually, kids tell the truth with my own experience, so if they lie it has often to do because they are afraid to get any problems with their parents, drugs, drinking, or because they are ashamed and don't know what to say, to think, or to do. And X200B, so be careful with young patients. Not a doctor but work in a psych hospital. Walked into a patient's bathroom at 3 AM. BC. He was in there for a suspiciously long time, to find shit smeared literally everywhere, and he's standing there butt ass naked staring at me. He swears up and down he has no idea how it got there, and he was just as surprised as I was. I just turned, walked out, called the violent code team to come hose him down, and called the EVS team, environmental services, to come scrub and sanitize the bathroom. The entire time he's still in full denial he did not do it, even though they literally had to scrape shit out of his fingernails and out of his eyebrows. Called the on-call doctor who ordered him to be a full one observation from then on out. So congrats buddy, you now have to have someone watch you eat, sleep, and shit for the next few weeks. My father is a doctor, and once a patient had an eggplant in his ass and he just fell on top of it. My parents are both doctors. One time my mom told me that there was nothing too weird that I could tell or ask her, because she's heard it all before. For example, once a woman came in with severe intestinal cramps. Turns out she had 2 tampons shoved up her vagina. She swore she only had one, and could hardly believe what the nurses told her they had found. People sometimes forget to take them out and put a new one in. I've heard interesting stories. Pet rat bit them. Only found out from SO. Confronting her in front of the team, asking if the patient had told us about the rat bite. Patient looked likely she wanted to hush the SO. I got to up-tot the rat bite fever and talk with the macro people. It wasn't, and the broad spectrum antibiotics would have covered it, but was an interesting experience. A teacher once told me a story about a lady who brought a young child into the emergency department complaining that the child was sick from eating ants. The doctors struggled to see how that would make her sick. It wasn't until after some time and the child beginning to get very sick that the mum said she gave her own child ant poison to kill the ants she ate. Then told the doctors it must be the ants and not the poison. I can't find a link or source, but I remember my teacher telling me this story. A friend of mine was a nurse in the ER. A teenage girl came in and was in active labor. The girl kept saying she couldn't be having a baby because she had only ever had outer course. I'm not a doctor, but as a patient, the woman doing my MRI asked what kind of music that I liked, and I was too embarrassed to tell her. MRIs are very loud. Most places have headphones to play music or earplugs if you don't want music. She was probably just going to set it to whatever music you wanted. 90% of this thread is going to be about people shoving things up their ass. That a young woman who convinced a local quack to give her a PICC line, semi-permanent IV catheter, for chelation therapy for chronic Lyme disease, not a thing, was uncapping the line, sucking out her own blood, and spitting it into her urine samples to 1, fake having a severe kidney problem, and 2, cause real anemia. She did it so much she became severely iron deficient. This was despite catching her in the act after we became suspicious. Suspicion was raised because she kept having fevers. Blood cultures grew strange bacteria known to live in the mouth. My sister talks about this couple where the guy keeps getting pee-hole damage from sticking like aux cords and such in there. They were super honest about it, I guess. Not a doctor, but my friend is a psychologist, and she had a patient refuse to admit she wasn't pregnant. That's right, wasn't. My friend was working in a very poor area of Venezuela, and this woman hadn't had any medical treatment or formal confirmation of her pregnancy. Venezuelan women don't consider themselves adults until they are mothers, so this young woman wanted to be a mother so badly she convinced herself she was pregnant, to the point she had an actual psychological pregnancy that caused her to genuinely swell, getting what looked like a third trimester belly. My friend tells me that when she finally got through to her, her belly started deflating like a balloon. The mind is an amazing thing. I'm a medical assistant for a derm and patients will come in for a genital warts follow-up, so I introduce myself and ask how the genital warts are doing. I don't have genital warts. The doc just froze some moles in my groin but they haven't gone away yet. Dude, you got genital warts. Cut the bullshit. I understand what you're saying and you are right, but I get why they wouldn't have the best response to your approach. Not a doctor but as a patient I continually deny any feelings of depression. My GP was the one that actually took me to the hospital after I tried to kill myself. But I still can't bring myself to tell him that I'm depressed. I think a lot of people deny depression or anxiety with their doctor, especially women. As soon as you admit it, most doctors write off everything as being in your head and ignore legitimate physical symptoms instead of trying to find the real cause. I always tell my gynecologist that my sex life is dry in front of my mom. Senior med student, will be getting my MD in a few months. The most fascinating patients are psychiatry patients. I had one guy with borderline personality disorder who was brought in by police to the psychiatry floor because he had left a note saying that he was depressed that his girlfriend of 1 week had broken up with him and that he was going to kill himself. He had messaged all his friends and family goodbye and driven to the nearby cliffs and was found by police preparing to jump. When I was talking to him, he denied that any such letter existed, and told me he was simply looking for bugs. It was hard to help him when he was so adamantly in denial that anything was wrong. Massage therapist here. During an intake, I always ask, any medications, surgeries, or medical conditions? Even when they have a full detailed paper intake, I always ask this question verbally as well. It's amazing what people won't tell me, but this one guy stood out. I get to his lower back and there's a fucking medical device on the table. Scared the crap of me. I just was not expecting to bump into something. I asked him what it was. Oh, that's my insulin pump. It doesn't matter. Not only did you not tell me you have diabetes, which absolutely matters, but you have a pump attached to your body and on my table. I 100% needed to know that. I'm touching your whole body. Yes, I need to know if things are inserted into it. Fuck me. Mostly people forget to mention that they've torn their hamstring 5 times as I'm in the middle of stretching it. Things like that which are honest mistakes, not hiding it. Or when they say nothing you need to know. My response is always try me. I get why you think your ankle surgery 10 years ago doesn't affect the massage, but it's so important I know so I don't traction your leg or scrub hardware under your skin. I need to know everything. Even if you just had 2 ibuprofen this morning. Oh, and this guy with a scar in his chest. I asked what it was from. Oh, a heart surgery a year ago. I about died. I'm working directly on your circulation. Dear God. This'll get lost with 0 upvotes, but I was working as a phlebotomist and a woman came into the air with gummy worms in her vagina that had been there for 5-7 days, but wouldn't talk about them or how they got there. They found them on her pelvic exam, but she just wouldn't accept that she had candy in her vagina and that's why it smelled so awful. Men who deny inserting things into their anus, yet here we are removing a foreign body from their anus. No idea how it got there though. I'm a patient but I have epilepsy and I've had neurologists ask me have you ever lost control of your bladder during a generalized seizure a million fucking times and I still lie for some reason even though they don't care and it's very common. Just because my mother used to shame me so hard for bedwetting as a kid and I'm embarrassed. I know you probably know this, so the comment is more for anyone else who might read this. Loss of bladder or bowel control is really embarrassing. But please don't lie about this one. It's an important bit of diagnostic info. Like, changes treatment plan sometimes. Breaking down and being honest about it is what got my grandma the right treatment. Obligatory, not a doctor but a medical scientist. We had a patient who had chronic hypoglycemia with no apparent cause. Patient underwent a pancreatic biopsy to see if there was cellular tissue damage. Biopsy came back clear. Patient said she wasn't on any medication either. Her hypoglycemia did not improve and she was scheduled in for another more invasive biopsy when it was discovered that she had stolen diuretic drugs, medication to control heart arrhythmia, high blood pressure, from her sister because she had read somewhere that they can help with weight loss. This patient had undergone surgery and was willing to go under the knife again but didn't want to admit to taking medication that wasn't hers, which would have been a very easy diagnosis. Not a doctor, but when I went to the hospital for appendicitis, the doctor told me if I ever had anything up my anus. I told him no, which was a complete lie. He said it's okay if boys your age do this. I was fucking terrified to talk about this because my parents were in the room and I was old enough to know what gay means, so I just told him number. I'm shocked that so many doctors use Reddit. It's actually really cool. My friend's dad works in there and he had a patient come in, highly distressed, because she had leaves growing out of her vagina. Turns out there was a potato inside her that she adamantly denied any knowledge of. The spud had apparently liked the climate and begun sprouting. Weird is a relative beast, but too frequently I deal with families with their 90-year-old demented grandparent connected to a ventilator, being fed through tubes in their stomach, who have not left a hospital bed in 8+ weeks and haven't been alert or awake in all that time, but somehow are doing great and are going to go back home with the spouse. I appreciate how tough denial is, but it never ceases to amaze me how much we, humans, can mentally disconnect with reality when we can't cope with our situation. The only thing worse is coding these patients. An old friend of mine is a nurse masters. He works at the local mental health facility. He told me that they had a woman come in needing mental health help, and while they were assessing her, 44F 300 plus lbs, she had to help her clean up because she had really bad body odor. Turns out, while at home, he cat had kittens, and one of the kittens got stuck and suffocated in her side stomach folds and had died. She didn't know, and the kitten corpse was stuck there rotting. He said it was one of the worst things he saw and had a hard time documenting it. Not a doctor, but I have it on good authority that men will show up with light bulbs, terracotta pots, or other objects like other commenters have mentioned, stuck in their rectum. Just one, not all at once, lol. How it got there? I fell on it, and the wife always nods along to the story. Edited to reflect the fact that straight guys can enjoy anal play too. Straight guys can enjoy anal play. It's a sexual act, not an orientation. Had a patient who came to clinic convinced she had bugs crawling in her skin and fibers coming out of her skin. Biopsy and a thorough exam didn't show anything. She exhibited a controversial disease called Morgellons disease, which has an aspect of delusion to it. We referred her to psychiatry. Not my story, but my dad's. This dude had a tiny shot glass up his rectum and refused to admit that it was there. My dad looks at the scans and it clearly shows it there, and when shown to the guy he still wouldn't admit what was in there. Patient here. I had sepsis 2 months ago, and the doctor was absolutely convinced it was E. coli from something I ate. This was apparently the most common cause of community-caused sepsis for people. He interviewed me multiple times, even sent my parents out of the room to ask me how often do you eat Indian food. He was going to find out the origin of the bad sandwich, rice bowl, burger, whatever it took. But, every time I explained I pretty much ate out of the Trader Joe's frozen food section, and I rarely ate out, and hadn't in the past few weeks other than really safe fast food. He never gave up. Gosh darn it, someone out there was serving E. coli laden food and he was going to get to the bottom of it. But he was never going to get me admit to eating sketchy food, because it ended up being this crazy rare, pretty much 1 in a million infection with no firm explanation for how I got it. Not from food though, it usually comes from tonsillitis, but I never had tonsillitis in the months prior. I hold no ill will for the doctor, on the contrary, he left no stone unturned to figure out what was wrong with me, but there was no question he could have asked, or test he could have ran that would have enabled him to figure out the disease, and thus switch to tuned antibiotics, before the blood cultures came back from the lab 3 days later. My symptoms made no literally sense. Gosh darn it, he tried though. He was not letting some adolescent die in his hospital for no good reason. He ran a ton of tests and met with me all the time while I was admitted. I'm very grateful for his help and his resolve on what had spiraled into the plot of a House MD episode. For the medical folks, it was Fusobacterium necrophorum without Lemire syndrome symptoms. It was very odd. TLDR. Doctor tried to get me to admit to eating sketchy food. I refused and held my ground, because I never had consumed sketchy food. I highly recommend Adam K's This Is Going to Hurt for lots of nasty OB-GYN stories. The story of the kinder egg has to be the worst. Buddy's mom worked as a nurse at a hospital in Michigan. It eventually came to her attention that an elderly male patient had convinced 3 of the other younger, less experienced nurses, or aides, that he needed his rectum stimulated, for some reason. Old guy was getting his butt diddled a few times a day until Buddy's mom put a stop to it. He wouldn't admit he was lying about needing the butt treatment, though. RN here. One super obese woman on my unit complained of a horrible smell from her vagina. It reeked so bad one staff member puked. There were hot dogs from her lunch trays that she stuck up her vagina. She kept denying it but refused to let us remove them. Also refused a psychiatry consult. As far as I know, she discharged with them still inside. Not a doctor, but I worked in an animal hospital for a while. We had a dog come in terrible shape. Vomiting, glass eyes, crying profusely, convulsing, lethargic as fuck, and could barely stand up and let alone walk on his own. Broke my heart to see as I was in the room with the vet. The owners swear that they had no idea what was wrong. Said the dog had been inside for most of the day and that they didn't think it had gotten into anything that could cause it to be so sick. We ended up keeping the dog to further watch it and monitor its condition. One doctor thought it could be acute marijuana toxicity, or something along the lines of that, from eating weed or a brownie or something. Had good reason to believe it because the owners reeked of pot and were both high as a fucking kite. However, when asked, both insisted they have never used pot and that there was no way the dog could have ingested any. Because we weren't sure of what was happening, we placed the dog in quarantine in case it was something contagious that could spread to other dogs in the hospital. And when we did that, we had to completely disinfect the room. I went in to start cleaning it, wiping down counters, walls, instruments, etc. As soon as I start sweeping, I noticed something on the ground. Leaned down to take a closer look thinking it's just a turd or something. But what did it end up being? A little nug of the electric lettuce. I immediately told one of the vet techs who called the owners. They got super nervous after asking if they were sure that the dog didn't ingest anything and hung up almost immediately after being asked. Seeing as we weren't sure though still, we couldn't treat the dog for marijuana toxicity. 2 other doctors tried calling and nicely asking with the same result as the vet tech. Finally, my favorite and super sassy vet called and taught them a new one. Basically saying they needed to own up to it if the dog accidentally ingested the weed, or else they may not ended up having a dog to pick up from the hospital in a few days. That was the point where they decided to mention that a quarter of their freshly baked pot brownies were missing. I was off shortly after this happened, so I don't know exactly what they ended up doing. But a fake the pupper ended up surviving and recovering a day or 2 later. Sweetest dog too. Even in the terrible shape he came into the hospital in, he loved everyone. Those owners almost lost their dog because they were too afraid to admit they smoke weed. TLDR. Super sick dogs with dumbass owners who didn't think they should have mentioned that their dog had eaten a metric fuck ton of pot brownies. Not a doctor, but I know a guy who got a Sharpie cap stuck up his ass, and had to go to the edit. To all of you commenting our butcher piece, thank you. Very few will see it, but I want to share. I get hurt sick a lot and I've been x-rayed minimum of 80 times. I got bored at some point and started asking What the weirdest thing you've seen in an X-ray? My favorite answer will always be, the guy with the 3 cucumbers. Me. 3. Why didn't he stop? X-ray tech. Guess he wasn't finished yet. I laughed so hard we had to wait to finish the X-ray. Well, this is AskReddit, so here I go. Not a doctor, but my girlfriend did an internship in a pediatric clinic, and there was this baby that had been shaken intensely by his parents to calm him down, which caused a lot of damage to the kid's nervous system somehow. As I said, I'm not a doctor. Those two shits did not deny that they went all swaggy barkeeper on their kid, but denied responsibility for turning their kid into a vegetable. They were absolutely sure that the damage was caused by humanity's nemesis, vaccines. Not a doctor, but my uncle is a psychologist, and for a while I would help him in his office organizing things. I would always leave when a patient entered due to HIPAA conflicts. However, I would always hear conversations over the phone. My favorite one had to have been between my uncle and someone who had been recommended to him after some pretty bad breakup proceedings. U equals uncle, P equals patient, U, hello, P, I got your message that you wanted to talk to me. No, I can't arrange a meeting between you and your ex. No, I can't. She has a restraining order against you. Yes, you have been violating it. P. Your ex produced emails sent by you talking about things that you have seen her doing without her knowledge. Your text messages have even been subpoenaed, and you have admitted to have been stalking her. Look, I can't arrange a meeting, and even if I could, I wouldn't. Stop wasting my time with this. If you actually need something from me, call, but stop asking me to set up meetings. I had heard him talking with, and about this particular patient, and apparently he had a big problem admitting that he had been stalking his ex, even though there was irrefutable evidence as well as personal admissions saying that he was doing it. Not a doctor, but I do medical records, so I probably know more about the patients than they do. We had a patient come in the ER with a broomstick lodged in his rectum. Actually perforated the colon. He said he was walking through the living room carrying the broomstick and fell, and it went right up his asshole. Because don't we all carry our brooms directly behind us, pointing up, while naked from the waist down? We had a different patient come in with a sawed-off broomstick that went in through his rectum and almost out the perineum, or taint, for my readers with no medical background. He got a colostomy and nearly lost a ball. He also said he fell, but was honest and said that he fell while having sex trying to reconcile with his ex-wife. I really wish I knew if those two crazy kids made it. Please tell me the doctor of the guy who did the TIFF about eating live bugs all his life is on here. It's all I need right now. Niece of the doctor. Turns out the whole homophobic guy saying IDK how this ended up stuck in my ass. I'm not a fucking effort is pretty much a weekly routine on the R's, which says a ton about how our society fucks up with people. The comments. Guy who eats spiders, replies, OMG. You must be a fellow member of that obscure subreddit that has 14 million members. Christ. One time one of my patients wouldn't admit that he drank a bunch of paint at a paint picnic party. He was totally covered in paint and he had all the symptoms of drinking paint, but he wouldn't admit to me that he was at a paint picnic party. I think he was ashamed of what he had done.